It's a Northwest News Radio weekend. IRG's Health Talk continues.
Our first guest, Paulette Deckers, a board-certified hypnotherapist at Deckers Hypnotherapy. Hypnotherapy is something we haven't really touched a lot on this show, Shannon, but this is something that I'm sure is a big factor in therapy.
Well, the show is Health Talk, and Paulette helps people understand their mental health using hypnotherapy, which is getting to your subconscious.
Here we go, Paulette Deckers and Shannon O'Kelly.
Paulette, thank you so much for joining us, Health Talk here. How are you?
I'm good, Shannon. Thank you so much for inviting me and having me on today.
Well, congratulations. You're a first. I'm not sure I've ever had a hypnotherapist on Health Talk, so I'm certainly excited to talk to you. So as we get started here, tell our listeners kind of your background and how you became interested in hypnotherapy, and then we'll get into the nitty-gritty. But tell us about Paulette Decker and your interest in hypnotherapy.
Yeah. Well, just to clarify, it is actually Deckers.
Okay.
An S on the end of my name, which is not common for that name. But I got involved in hypnotherapy about 5 years ago. It's something that I experienced as a teenager when I was in some counseling for some issues at that time in my life. And I really found it interesting and fascinating. I was going to go to college for a psychology degree. Life had other plans for me. And so fast forward 30 years, and I decided to leave a different industry and kind of, go a different course. And I wanted to get back to helping people. So I started researching how can I do that as quickly as possible without having to go back and get a 4-year degree. And I found that hypnosis was something that I could get into pretty quickly and start a business pretty quickly. And so I went and I experienced it again for myself. It had been many years. And I just loved it. I loved how quickly it got to the root of the issue. I loved that I didn't have to kind of rehash my my history like we often do in counseling. And I was just so pleased at how quickly the results came about. And I decided to go ahead and become certified. And that's kind of how I got going in this industry. And I absolutely love the work I do. It's very fulfilling.
It sounds fascinating. I mean, I'm reading some of the information that you provided us, and I think that what you just described, you experienced this personally. And is that what you call your revelation, kind of that experience to kind of pursue becoming a hypnotherapist? Is that fair to say?
Yeah, well, I guess it depends on your definition of revelation, but yeah, I think so.
Yeah, okay, all right. Well, it's always interesting. I mean, in the world of medicine, particularly in physical therapy, for example, that's what I am. I'm a physical therapist. It's amazing how many people become physical therapists because they experienced PT themselves through an injury. Right. And sometimes when you experience that and you go through it, then you have more passion or desire to help others. But for our listeners out there, I think it's important that we talk because, I mean, when they were hypnotized on some show and they were like, someone told them to crow like a rooster, right? And I mean, that's maybe what the general public thinks hypnosis is, the comedic routine or something like that. But tell us the training, tell us the background and what you're affecting.
Right. So it's funny that you should bring up entertainment hypnosis or street hypnosis or, any of those things that people are most often exposed to. And there isn't really a difference in regards to how a hypnotist in that realm gets people to be in a state of hypnosis versus how I do it. The only difference is that they're really good at picking out the people in the crowd who are very suggestible and will participate. So but yeah, as far as clinical hypnosis, I have over 100 hours of certification. Actually, I have probably more like 200 hours of certification. I've taken many different classes to help me become the best hypnotherapist I could be. I work a lot with anxiety. I work with grief, loss, stress, sleep issues, fears, phobias, just kind of the general emotional things that from day to day really affect our lives. And I love the trainings I get from various people in my industry who've been doing it longer than me and have kind of figured out a way to refine it and make it more beneficial for not only the practitioner but the patient or client, as we call them in our industry. And so I kind of lost track of the question.
Well, the question is, we're going to come back and we're going to talk a little bit about the process and what I would experience if I was to visit you in your office. So we need to take a break real quick, and you're doing a great job. And the question was, what got you started and what do you do? But we'll get into that a little bit more after the break here, okay?
All right, thanks.
Our conversation with Paulette Deckers and Shannon continues after this timeout on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Back to our conversation with Paulette Deckers and Shannon O'Kelly.
Well, we're talking to Paulette Deckers here on Health Talk. And Paulette is a hypnotherapist, and it's quite fascinating. Paulette, what is the difference between going to hypnotherapy versus maybe going to talk therapy? That's my first question. And once we get that answered, I'll ask a couple others, okay?
Absolutely. Thank you so much for bringing that up. There is a difference. There is definitely a difference in talk therapy. And don't get me wrong, talk therapy is wonderful. I participate in it myself. But the difference would be that when you go to a hypnotherapist, you don't necessarily rehash your past, explaining things. What we can do in hypnosis is we can help you get to the root of your issue as quickly as possible by tapping into your subconscious mind. You can't do that as easily or as well in talk therapy because you're mostly functioning and working out of your conscious mind. Where we need to go is our subconscious mind, because that is where all of our belief systems, our kind of triggered responses, our trauma, our just all of that stuff that we've experienced in life. And so when we go there and work in that space, we get a lot quicker results, I guess is the best way to describe that.
Interesting stuff. All I can say is the brain is one fascinating organ. And gosh,
it is.
My gosh. I mean, you just talk about the subconscious, conscious. So I guess to summarize, what you're doing is you're getting your clients, patients to get into that subconscious state and then kind of deal with things. And you mentioned some of those things you can help with, but I'm interested, being a physical therapist myself, we see so many people that just pain overtakes their lives. And obviously anybody out there that's ever had pain, experienced pain, affects your quality of life, your function, and it can be problematic for a lot of folks. Do you deal with pain and treatment of pain in that subconscious level?
I can to a degree. It's not my primary focus of work with people. There are hypnotherapists out there who do work a lot with pain. But as far as pain goes and hypnosis goes, what we know, Shannon, is that our minds are incredibly powerful. Pain signals are created in the brain, and that pain signal goes to wherever that pain is actually coming up inside the body. What we can do with hypnosis is we can help the mind minimize the intensity of the pain signal. And so we just try to help the individual learn to go up into their mind, into their subconscious space, learn to kind of connect with where that pain is coming from, and help them decrease, because emotions increase. They increase the intensity of the pain, where if we can get the emotions to calm down, we can help that individual lower the pain in their body. Doesn't mean it's going to go away 100%, but if it's normally sitting at like a 7 or an 8 on that, a SUD scale, we can lower it down to a 1 or 2, which is far more manageable for anybody that's dealing with, chronic pain.
Okay, Paulette, man, you have been fascinating, and congratulations, our first hypnotherapist that we've talked to, and you were great. We are out of time. I want to have you back in the future. I'd like to ask some more in-depth questions about some of the things you can help folks with, but fascinating stuff that you're doing. Thanks, Paulette Deckers, for your time.
Thank you, Shannon. It's great to be here.
All right, that's been Paulette Deckers, board-certified hypnotherapist at Decker Hypnotherapy. And Shannon, pretty interesting stuff there.
Oh, absolutely, Tom. Like I said earlier in this segment, I think most people think hypnotherapy, you're at that event and someone's going to hypnotize you and you're going to crow like a rooster, right? I mean, what Paulette is doing here is getting to that subconscious that I think helps people understand and work on some of the things we need to work on, going to that subconscious state, which is interesting.
We appreciate Paulette joining us. Our next guest right after this time out on Northwest News Radio.